Attention seniors, 9 common medications that may accelerate dementia. Hello and welcome. Today we're counting down 9 common medications that may speed up memory loss or dementia in seniors. Some of these might surprise you. They could even be in your medicine cabinet right now. Could the pills meant to help you actually be harming your brain? It's a scary thought, but staying informed is key. Many seniors take 5 or more medications a day, and all those drugs can interact in ways that quietly affect memory and alertness. Before we get started, please subscribe to our channel and hit the notification bell for more senior health tips. And if you learned something new, give this video a thumbs up. It really helps us out. Now let's dive in. We'll start at number 9 and work our way down to number 1, the biggest culprit of all. 9. Muscle relaxants. We start with muscle relaxants. Those pills for back spasms or neck pain. They might loosen your muscles, but they can also loosen your memory. Drugs like cyclobenzaprine work by sedating your nervous system, which also slows brain activity. For older adults, that means drowsiness, confusion, and short-term memory problems. They also block acetylcholine, a brain chemical essential for learning and recall, which explains the brain fog many users report. Research links long-term use of these meds to higher dementia risk. So if you're taking them regularly, ask your doctor whether physical therapy, stretching, or a lower dose might help instead. Think muscle relaxants are surprising? Wait till you hear number 8. It's a medication for brain electrical storms, and it might shock you. 8. Anti-seizure medications. Next up, anti-seizure medications, also known as anticonvulsants. These include drugs like carbamazepine, Tegretol, and gabapentin, Neurontin. While originally developed to prevent seizures, they've found a second life treating nerve pain, mood disorders, and even restless leg syndrome. For many people, they can make life far more comfortable, but they can also leave the brain feeling a bit sluggish. Here's why. Anticonvulsants work by calming overactive nerve signals in the brain and nervous system. That same quieting effect that tames seizures or nerve pain can also slow down your cognitive processing. Many seniors describe it as mental fog. This isn't just imagination. These drugs directly affect communication between brain cells. Common side effects include drowsiness, dizziness, and confusion, and they tend to intensify with higher doses or when combined with other sedating medications, like opioids or sleep aids. In older adults, who already metabolize drugs more slowly, these effects can become even more noticeable, sometimes leading to balance problems or falls. Long-term use may also be linked to cognitive decline, especially if the medication is taken for years without review. Doctors now recommend periodic medication check-ins to ensure the benefits still outweigh the risks. If you're experiencing unusual forgetfulness, grogginess, or brain fog while taking an anticonvulsant, don't just power through it. Talk to your doctor. Sometimes the dosage can be safely reduced, or a newer, less sedating alternative can be prescribed. We've talked about calming muscles and brain waves. Now let's move to a class of meds that calm mental storms, sometimes a little too much. 7. Antipsychotic drugs. Number 7. Antipsychotic drugs, including haloperidol, Haldol, and quetiapine, Seroquel. These medications are prescribed for serious mental health conditions such as schizophrenia, bipolar disorder, and, in some cases, severe agitation or aggression in dementia. They can be life-changing for those who truly need them, but they come with significant trade-offs, especially for older adults. Antipsychotics work by blocking dopamine, one of the brain's main reward and motivation chemicals. This helps reduce delusions and hallucinations, but it can also dampen alertness, slow thinking, and reduce emotional engagement. Many people describe feeling flat or detached while on them. For seniors, these effects can be particularly strong, leading to confusion, memory lapses, and an overall sense of mental dullness. The physical risks are just as concerning. Decades of research have shown that antipsychotics can increase the risk of stroke, heart problems, and even death among dementia patients. Because of this, the FDA has placed strong warnings on their use in older adults with cognitive decline. That's why most doctors today try to reserve these medications for situations where they're absolutely necessary. If a loved one seems zoned out, unusually sedated, or emotionally distant after starting an antipsychotic, it's worth having a medication review. Sometimes, symptoms like agitation or confusion can be managed more safely through environmental adjustments, routine changes, or milder medications. We've covered mind-calming drugs. Now let's talk painkillers. 6. Narcotic painkillers, opioids. At number 6, we have opioid painkillers, drugs like oxycodone, hydrocodone, and morphine. These medications are among the most powerful tools doctors have for controlling pain, especially after surgery or during serious illness. When used correctly and for short periods, opioids can be life-changing. But when used long-term, they can quietly start affecting more than just your body. They can affect your mind. Opioids work by binding to receptors in the brain and spinal cord to block pain signals. The problem? Those same receptors also influence alertness, focus, and memory. For seniors, whose brains are already more sensitive to medications, the effects can be even more pronounced. Many older adults on opioids experience confusion, slowed thinking, or even episodes of delirium, sudden disorientation that can mimic dementia. Long-term use adds another layer of concern. Some studies suggest that chronic opioid exposure may increase dementia risk, possibly due to reduced oxygen flow to the brain. The safest approach is careful management. If you take opioids regularly, work closely with your doctor to find the lowest effective dose and to periodically reassess whether you still need them. In some cases, non-opioid pain relief, like acetaminophen, topical creams, gentle exercise, or physical therapy, can make a meaningful difference without the same mental side effects. Pain is one thing, but what about mood? Number 5 is an antidepressant that might, ironically, depress your memory. 5. Tricyclic antidepressants. Halfway through the list, tricyclic antidepressants, the older generation of mood medications that includes amitriptyline, doxepin, and imipramine. While these drugs were groundbreaking decades ago, they're now mostly prescribed for off-label uses, like managing nerve pain, migraines, or chronic insomnia. And while they can be effective, they come with a major downside that hits hardest for older adults. They're highly anticholinergic. That means they block acetylcholine, a vital brain chemical responsible for memory, attention, and muscle coordination. When acetylcholine levels drop, your brain's ability to store and retrieve information suffers. The result? Confusion, mental fog, drowsiness, and forgetfulness. One major study published in JAMA Internal Medicine found that older adults who use strong anticholinergic drugs for 3 or more years had a 54% higher risk of developing dementia compared to those who didn't. That's not a small number. It's a wake-up call. If you're currently taking a tricyclic antidepressant, don't panic, but do talk to your doctor. There may be safer alternatives available, such as SSRIs, selective serotonin reuptake inhibitors, like sertraline, Zoloft, or escitalopram, Lexapro. If you're finding this video helpful, hit that like button and subscribe to our channel. It keeps this kind of content coming your way. Now, on to number 4, the one that might keep you up at night. 4. Sleeping pills, Z-drugs. Coming in at number 4, the so-called Z-drugs, including Zolpidem, Ambien, Ezopiclone, Lunesta, and Zaloplan Sonata. Their purpose is simple: help you drift off faster and stay asleep longer. But as many long-term users can attest, these pills sometimes help you sleep, and sometimes help you forget. Z-drugs act on the same brain receptors as benzodiazepines, enhancing the effects of GABA, the neurotransmitter that quiets brain activity. The problem? That same calming effect can easily slip into memory disruption, confusion, or strange nighttime behavior. Reports have surfaced of people walking, eating, or even driving in their sleep. Others wake up to discover they've texted friends, cooked a full meal, or written emails with no memory of doing so. Experts now recommend using Z-drugs only for short-term sleep problems and only under close supervision. If insomnia persists, doctors suggest safer approaches like sleep hygiene routines, relaxation techniques, or gentle natural aids such as melatonin or magnesium. Don't fall asleep yet. Number 3 deals with a common issue for seniors: bathroom urgency. 3rd, bladder control medications. At number 3, Incontinence drugs such as oxybutynin, ditropan, and tolterodine, Detrol. These medications are commonly prescribed to calm an overactive bladder, an issue that affects millions of older adults. They work by relaxing bladder muscles, reducing those urgent, middle-of-the-night trips to the bathroom. Sounds great in theory, right? Unfortunately, there's a hidden cost that many people don't realize. These drugs belong to a class called anticholinergics, meaning they block the action of acetylcholine, a neurotransmitter vital for muscle control, memory, and learning. While this helps calm the bladder, it also interferes with brain function. The result? Confusion, disorientation, and forgetfulness. Side effects that can easily be mistaken for early signs of dementia. The good news is that there are safer options. If bladder control is becoming a challenge, ask your doctor about newer medications that work differently or have less impact on the brain. In many cases, lifestyle adjustments, like reducing caffeine, doing pelvic floor exercises, Kegels, and timing fluid intake, can make a big difference without the cognitive trade-off. Up next is one of the most common culprits, something you've probably taken for allergies or a cold. Second, antihistamines, first generation. Number 2, first-generation antihistamines, including familiar names like diphenhydramine, Benadryl, and chlorpheniramine. You'll find them in countless over-the-counter allergy pills, cold medicines, and even nighttime sleep aids. They've been around for decades, and that's part of the problem. These first-gen antihistamines work by blocking histamine, the chemical that triggers allergy symptoms like sneezing and itchy eyes. But they also block another critical brain chemical called acetylcholine, which plays a major role in memory, learning, and alertness. That's why people often feel groggy or foggy after taking them. Their brains are literally being slowed down. For younger adults, that might just mean a sluggish morning. But for seniors, even a single dose can cause confusion, dizziness, or loss of balance. One major study published in JAMA Internal Medicine found that long-term use of these anticholinergic drugs, like diphenhydramine, significantly increased dementia risk in older adults, even at moderate doses. The good news? There are safer alternatives. Newer, second-generation antihistamines such as loratadine, Claritin, cetirizine, Zyrtec, and fexofenadine, Allegra, work without crossing the blood-brain barrier, meaning they target allergies, not your memory. And now, for number 1, the medication most strongly linked to memory problems and dementia. 1. Benzodiazepines. Topping our list are benzodiazepines, a powerful class of anti-anxiety and sleep medications that includes familiar names like diazepam, Valium, alprazolam, Xanax, lorazepam, Ativan, and temazepam, Restoril. For decades, these drugs have been prescribed to calm nerves, ease insomnia, and help patients through panic attacks. They work by enhancing GABA, a neurotransmitter often called the brain's calm-down chemical. Think of GABA as the internal brake pedal for your nervous system. Benzodiazepines make that pedal stronger, helping to slow racing thoughts and relax tense muscles. Long-term use can become a serious problem. These drugs are central nervous system depressants, meaning they slow brain activity. And over time, that sedation doesn't just affect anxiety, it affects memory, balance, and mental sharpness. Short-term memory loss is one of the best-known side effects. In fact, some versions of benzodiazepines are deliberately used in medical procedures to induce mild amnesia, so patients won't remember discomfort. Among seniors, this memory blurring effect can contribute to falls, confusion, and disorientation, sometimes mistaken for early dementia. Even more concerning are the long-term risks. Multiple studies have found that prolonged benzodiazepine use, particularly beyond 6 months, is associated with a significantly increased risk of developing dementia. Researchers aren't certain if the drugs directly damage brain cells or simply accelerate cognitive decline in those already vulnerable, but the link is strong enough that geriatric specialists urge caution. Doctors today recommend benzodiazepines only for short-term or occasional use, and many now look for safer alternatives like therapy, non-sedating sleep aids, or mindfulness-based stress reduction. If you're currently taking one, never stop abruptly. Withdrawal can be dangerous. Instead, talk to your doctor about a gradual tapering plan to come off safely. Here's a quick recap of the 9 medications linked to memory decline: muscle relaxants, anti-seizure drugs, antipsychotics, opioid painkillers, tricyclic antidepressants, Z-drug sleeping pills, bladder control medications, first-generation antihistamines, benzodiazepines. Now, this doesn't mean these medications are bad or that everyone who takes them will develop dementia. They all have legitimate uses. But for older adults, they can come with risks, especially when taken long-term or in combination with others. If you recognize any of these on your medication list, don't panic. Just talk to your doctor or pharmacist about possible alternatives or dosage adjustments. And remember, never stop any medication without medical advice. If you found this video helpful, please subscribe, like, and share it with someone who might benefit. And comment below. Have you noticed memory issues from any of these medications? Your story might help someone else. Thanks for watching. Stay healthy, stay sharp, and we'll see you in the next one.